talk a little bit about those patient populations with known underlying cognitive impairment, sometimes significant underlying cognitive impairment. Specifically here I'm talking about patients with dementia. Dementia and dysphagia are part of the same profile. Dysphagia is a common symptom in patients with dementia, but the type of dysphagia, the manifestation of the dysphagia, the severity of the dysphagia is going to be different depending on the type of dementia, the underlying cause of the dementia, and depending on the severity of the dementia, where the patient is in that progression of cognitive decline that we see with dementia. Patients with Alzheimer's dementia, dementia caused by Alzheimer's disease, typically have later onset of swallowing problems. The dysphagia usually doesn't occur until later in the disease progression. Interestingly, though, there was one study that looked at patients in early to mid-stage Alzheimer's disease, and they did swallow studies. Now, these were people who were not complaining of any swallow difficulty, whose family members had not reported any swallow difficulty, but they found some deterioration in function, some slowness in terms of laryngeal response, small amounts of pharyngeal residue. So the swallow process was beginning to deteriorate in those early to mid-stage folks. It doesn't really seem to manifest itself as a true disordered swallow, however, until later in the disease process with patients with Alzheimer's type. Patients with Lewy body dementia, this is the dementia that's often associated with Parkinson's disease. We tend to see dysphagia symptoms happening in middle stage of the process when the disease reaches sort of a moderate degree of severity. In patients with vascular dementia, it's a whole lot harder to predict, right? What happens with vascular dementia is some parts of the brain are deoxygenated because of small strokes or what have you. So the onset of the dysphagia is hugely variable depending on which part of the brain has been affected, and that's different in different people, as we know.